I'll have to say that I was as astonished as anyone might be that ivermectin has potential as an anti-cancer agent. I'm a cancer surgeon. We don't do parasites, okay? We don't do ivermectin. And I was not really even familiar with those people who use ivermectin. And so when, in the early days of COVID, when it became clear that ivermectin was effective in preventing and treating patients with a SARS-CoV-2 infection, I began to be aware, having looked in the literature, that there was 20 years of research showing that ivermectin had great potential in the treatment of cancer. I was introduced to a patient with stage 4 prostate cancer. Had received 2 vaccines, perfectly healthy, marathoner, no history of cancer in the family. 2 months after his second Pfizer shot, he works for the government. He's going to lose his job and his pension if he wasn't vaccinated. He was diagnosed all at once with stage 4 prostate cancer. He tells a very compelling story, melodramatic story about that 24-hour period of time in his life. And he went through the traditional protocols: radiation, chemotherapy, pharmacologic castration, all of it, over a period of 9 months. And then his doctor said, you know, there's really nothing else we can do. And his name is Paul Mann, and he was like, can't you give me more radiation? No. Can't you give me more chemo? No. Aren't there any other drugs? No. Are there any clinical trials? There's nothing. Hospice. Send for the priest. So a friend of his knew me, and she said, would you give Paul a call? He just needs some moral support, something. So I said, sure. So I began calling him. We spoke about once a week for 3 weeks, and finally, the poor guy was suffering. He had cancer in 11 bones in his body. His right leg was completely swollen, obstructed with tumor. He's miserable. And I said, Paul, I don't know if this is going to help you, but I know it's not going to hurt you. I just can't imagine, based on my judgment and understanding of the scientific literature and all of the work that Drs. Corey and Merrick had done, and others around the world, that ivermectin would hurt you. It might help. I can't say. So he said, you know, I'll give it a try. And he drove to Tennessee, where you could get it without a prescription. P.S. I discovered last night, having dinner with Paul and his wife, Terry, he drove from where he lives in Missouri to Tennessee and paid cash for his ivermectin. That's it. He didn't submit it to an insurance company. He didn't tell anybody back in Missouri, his oncologist, no. His ivermectin prescriptions are listed in his chart. How did that information get from the pharmacy in Tennessee to his chart in Missouri? We don't know. Somebody does. I'd like to know myself. Anyway, he starts taking ivermectin, and he doesn't have any problems with it. And I talk to him every week. And how are you feeling? Well, no change. Next week, maybe a little bit better. I don't know. How's your leg? It's not quite as swollen. How's the pain? Pain everywhere. Maybe a little bit better. Slowly, slowly, slowly. Not getting worse. Not necessarily getting better, not getting worse. Fast forward. 2-month follow-up appointment at the clinic. They didn't expect to see him. Okay, he's like, Paul. He's feeling a little bit better. They do a PSA, which was off the charts to begin with. And if I'm not mistaken, at the time they randomized him to hospice, I think it was in the hundreds, maybe 700, 800.
What does that mean exactly for the layperson?
Over 4 would be abnormal. Mm-hmm. Okay, so what are we talking about here? Prostate cells normally secrete a protein, prostate-specific antigen. Mm-hmm. It's one of the things that they do. Cancer cells that originate in the prostate, that are dividing rapidly and growing fast, are spitting out PSA, okay? It's not that they're contributing to the body economy in any way. It's just they just want to multiply and divide, and that's the end of the story. And so your PSA levels start to rise, which is a marker, a screening marker. Oh, your PSA was 4, and now it's 8. Let's do a prostate ultrasound, whatever. So PSA can be a screen for the emergence of a tumor, but it can also be used, particularly at high levels, as evidence for cancer, response to cancer, recurrence of cancer. His was, I mean, it's supposed to be, 4, yeah, it's hundreds. Okay, he goes back for his 2-month appointment. It's 1.3. They said, you're in remission. Well, not, complete remission. He still had the bone mets, but you're in like a biochemical remission. Well, that was good news. Slowly, he begins to improve. Less pain, swelling is okay. A lot of other vaccine injuries, however, he's getting better. He's getting better, giving him nutritional support and other supplements. He's having TIAs, little mini strokes. But he didn't tell me about that because we were talking about the cancer. But over a period of time, asking him questions, and I said, oh, you're having TIAs? His wife said, yeah, having TIAs. I said, what do the cancer doctors tell you? Because that's who he's seeing. They say it's not related to my cancer. It's like, so I get a call from his wife one evening. He's in the emergency room. He's had this TIA, whatever it is, catastrophic. And I said, Paul, what are they doing for you? And he said, well, they did a CAT scan of my head, and they said they don't see anything specific. It's a TIA, and it's not related to my cancer. They send him home. I said, did they do anything? No. I said, well, okay, call me crazy. I'm a cancer surgeon, but I think you need to see a cardiologist. I think there are things they can do, okay? And of course, I look it up really quickly, and of course there are things. So get him to the cardiologist, get him on blood thinners, no more problems with TIAs, okay? That's an indictment of the healthcare system. So he's getting better. About 9 months later, he's out dancing for 4 hours, 3 nights a week. He gets a head-to-toe rescanning, and 3 of the bone mets are gone. There's no growth of the mets that are there, no new lesions. There's only one hot spot, and that's where he received radiation therapy, and the radiologist really could not distinguish whether that was a tumor hot spot or radiation change. He is doing very well. Now, the vaccine injury is a problem, but the cancer is no longer a problem, except for the fact that it's still there, and we want to get rid of it completely. And he said, he called me from a hockey game, and he said, if I didn't know I have cancer, I would not know I have cancer. That was patient number 1. I was like, that's interesting. A second patient crossed my path. A guy in his 70s who had been losing weight for a year and a half, 40 pounds, not vaccinated, 40-pound weight loss, smoker, drinker, all he does is fish. And he could no longer swallow, and he could hardly talk. And so I got on the phone with him, and I said, Eddie, tell me a little bit about your history and so forth. He knew someone with prostate cancer who had taken Ivermectin. He cured himself from prostate cancer with that. So Eddie began taking Ivermectin. I have no idea what the dosing was. He was just taking it. And I gave him some advice about diet and, try and get the weight back on and so on and so forth. Within a couple of weeks, he sounded stronger. Sounded stronger. He could swallow. He had gained 6 pounds. His voice was better. Followed him for the next couple of weeks, maybe another month or so, and I said, Eddie, we need to get a scan. He doesn't have insurance, he doesn't like doctors, whatever. He had been diagnosed in that interval with 2 esophageal tumors, unresectable. Surgeons wouldn't go near it. The doctor said, well, we'll give you chemo and radiation, and Eddie said, no, you're not. So he takes his ivermectin, and maybe about 6 weeks later, I said, Eddie, you need to get a scan. I had to argue with Eddie to get a scan. We got the scan. No tumors. Gone. Gone.